Speech secrets.
Motor speech disorders affect the planning, control, and execution of speech production, which includes pronunciation. There's two types of motor speech disorders: dysarthria and apraxia of speech, and the treatment for these two are different. Dysarthria is an acquired speech disorder that changes someone's intelligibility because of problems with strength, speed, or control of the muscles required for speech. Those can be problems with the muscles in the respiratory system, in phonation, voicing, or with resonance and nasality. Can also be because of problems with the muscles of the tongue or lips or any of the other articulators. Dysarthria can be caused by brain injury, stroke. It can be caused by progressive neurologic disease like Parkinson's or multiple sclerosis. Depending on the type of dysarthria, the speech can sound slurred. It can sound like someone's been drinking. We call that an ataxic dysarthria. Or it can be very fast and the person can sound like they're mumbling. Treatment depends on the dysarthria subtype and which of the systems involved with speech are affected. So for example, if somebody has difficulty with breathing coordination and strength, and they run out of air while they're talking, then a speech therapist might do breathing strengthening, breathing coordination exercises to address the respiratory system. If muscles of the tongue are affecting speech pronunciation, if you stick out your tongue and it deviates to one side, then that side would be weak, and oral motor exercises could be used to help strengthen the tongue. I guess that's a plug for my oral motor playlist where you can find different oral motor strengthening exercises. If somebody has a hard time just being understood saying one word, then they're going to have even more difficulty being understood in conversation. And so that's why speech therapists work through a hierarchy, starting with sounds and words and working up to spontaneous conversation. Multisyllabic words and tongue twisters can be good coordination exercises with dysarthria. Slowing the pace and over-enunciating are often taught as compensatory strategies to help increase intelligibility. And I'll have more videos on this to come. I've gotten a good amount of questions about dysarthria. Apraxia of speech is less common. It affects the motor planning of pronunciation. And what's different about apraxia is the errors are not consistent. So for example, someone might want to say the word cat, but when they try, it comes out as dat and mat. And occasionally they might get the word cat, but it's different every time. Speech errors also tend to increase with word length. So the word cat is easier to produce than catapult. With apraxia, the muscles of the mouth usually have normal strength. There's not that weakness that you see with dysarthria. And automatic speech tasks like counting or saying the days of the week will come out fluently and accurately. So why does this happen? When we talk, the brain sends signals to the muscles of the mouth on where to move and how. With apraxia of speech, those signals are interrupted and arrive inaccurately to the mouth because of the brain damage. The brain damage is almost always in the left cerebral hemisphere and oftentimes accompanied by aphasia. Treating apraxia of speech requires a lot of repetition to retrain the motor targets, sometimes using mirrors for visual feedback or tactile cues on the face can help trigger the correct motor pattern. Some of my videos in the adult speech and language exercise playlist can be appropriate for somebody who has apraxia of speech, may also be appropriate for somebody with dysarthria depending on the type. Thanks for watching, and hey, be kind to yourself.